Hey, thanks for joining us today for our medical town hall. We've got Dr. Rafi here to talk to us about the COVID variants today, as well as Dr. Brandon Briery, who is the COCA president. He's going to help facilitate this discussion with us today. And we'd love to hear what your camp is planning in regards to keeping COVID out of camp. And we have a lot to learn from one another. So don't be afraid to share either in the chat or speak up. And I am going to turn it over. Well, actually, before we do that, Brandon, I'm going to ask Callie to move to the next slide because I'm going to do a shameless plug first. We have got some awesome education coming up for you guys next month. You don't want to miss this staff training summit with Professor Dave Malter from Gratz College. He's going to be helping us get ready to prepare to train your staff in April. So make sure you sign up for those sessions. And then in May, Brandon is going to do a session on camper and staff behavior. So join us for those. And I am now, go to the next slide, and I'm going to turn it over to Brandon.
Hello and good afternoon to at least most of us. I don't know if we have anybody who it's still morning in your time zone, but I think even on the West Coast, we're at noon at this point. So it's good to see everybody this afternoon. Dr. Rafi is coming from another meeting and is going to get here just as soon as he can. But I'll go ahead and just set some housekeeping ground rules a little bit. As he's talking, certainly if you have questions that come up, you can pop them in the chat so we don't forget. And I will be watching and monitoring that so that we can bring them back around at the right time. At the same time, it may be, very informal, and you may be able to just ask your questions out loud as Dr. Rafi is giving his update. So we'll play that by ear. If you feel like it's the right time and feel comfortable just turning your mic on and speaking up, you can certainly do that. But also, if you do put things in the chat, I will keep an eye on it, and I imagine that Jennifer and Callie will as well. So even if my eyes get distracted, then they'll help urge us along as well. But that's, oh, great. We do have a couple of folks from Hawaii, and yes, it is still morning there. So aloha to you guys. That's awesome. So are there any, while we're still giving some time for Dr. Rafi to join us, are there any things that, questions that are hot on your mind that we can go ahead and plug in?
I guess I'm curious, are you guys, for those of you who have applications open already for your season, are you guys seeing about the same number of applications as you have in the past? Fewer, more?
I see Beverly is saying more for them. Fewer for Camp Tecumseh. Consistent with 2022, smaller than COVID years. Questions about camper applications or staff? Because yeah, it's a good question, Chris. Because that I can say similar to what Kristen Whitaker said, camper applications are coming in fairly steadily for us. I always give the disclaimer that here at Camp we serve a lot of different disabilities and medical conditions. Cancer is a very small part of our population, but we haven't quite gotten to where we have typically been on camper numbers by this time of the year. It's been a little slower, but it's really more, excuse me, on the staff and volunteer side that has been a lot slower still. for us. So Dr. Rafi is here. At least that's what it says in the chat. I'm trying to find him.
Yep.
There
I'm
you
here
are.
now.
There you are. Can we spotlight him or pin him to the top, Jen? Cool. So Dr. Rafi, we're so thrilled to have you. It's always a pleasure, and you share so much, the good, the bad, the ugly with us, and really, you know, help us be better at what we're doing in healthcare and everything else for our campers and everybody who's part of our camp families. So I'd love to just turn it over to you and let you dive in with your updates.
Thanks, Brandon, and thanks to everyone for inviting me back. You know, y'all are spoiling me. You treat me so well, so thank you. Let me try and share my screen. Technology, don't fail me now. Let's see. Can people see the slides?
Yes.
Okay, great. Let me just put my phone on do not disturb so no embarrassing text messages come flying across our screen. Uh-oh. I don't know what it's trying to do. Okay, anyway, so state of where we are with updates, and then Jen and Brandon also asked me to talk a little bit about what Camp Tecumseh did last summer and what we're planning to do this summer. And I think there's going to be sort of a general discussion after about what other camps are planning to do this summer in terms of COVID protocols. So hopefully that'll be a good transition. So this is what I'm going to go over today, just what's going on with COVID globally right now, what's going on in the US, what the current variants are, what's up with vaccination and boosters, and a little bit about origins of the virus. And that's just because this has been in the lay press a lot lately. So just wanted to take a brief left turn and talk about some of that. So this is where we are with coronavirus cases globally. The Americas, so North and South America, are in sort of the mustard orange color here. And you can see, you know, contribute about a third of the global cases thus far in the pandemic. And, you know, we're still chugging along. I think we're all ready for this to be done, but the virus is not yet done with us. And, you know, with regard to deaths, I think this is quite striking because the deaths in the Americas is an even larger proportion of the overall deaths in the epidemic globally compared to the number of cases. And I think we can talk about why that might be a little bit later, but I think in general, the way vaccination and even some of the treatments have been politicized has really contributed to the excess deaths that we've had in the US, even out of proportion to the number of cases that we've had. So, you know, this is one of my favorite plots. It's from the New York Times. It tells us sort of where we are. And I think everybody was very fearful this winter that we were going to have another Omicron surge through the colder months that was going to coincide with RSV, respiratory syncytial virus, and influenza. And happily, that all didn't really come to pass. There was a small bump that you can see sort of around the holidays in early January of 2023. And we're sort of now at another low point. The average number of daily cases throughout the country is down to about 1,000. And if you look sort of below the red graphs, you can see sort of the test positivity rate, which is a good marker, even though we understand that the majority of people aren't testing in formal locations. They're doing home testing these days. And following the hospitalization rates, which after a peak over the holidays are down as well, and deaths sort of never really spiked up, which really speaks to this concept that we have that as each of the subsequent variants gets more transmissible, and they do, and every time there's going to be a new variant, it is by definition going to be more transmissible than the ones before. Otherwise, it wouldn't replace the previous variants. So when you hear the lay press say, oh my God, it's more transmissible than the last one, your immediate reaction should be, that's actually not news. Because if it weren't more transmissible, it wouldn't be replacing the old variant, because it's a foot race, right? And the ones that runs the fastest, which is the ones that's most transmissible, is always going to win that race. So don't be surprised when you hear that. It's overly dramatic and sensational, and it's meaningless. But with that acceleration in transmissibility, happily to date, we have seen progressive reductions in virulence. So, right, what Delta was one of the most deadly outbreaks that we had in the summer and fall of 2021. And happily, we have not seen the same sort of morbidity and mortality with the Omicron strains, and that's all of them, as we did with Delta. Now, does that mean it can't happen? No, there could be recombinations, and we could get a highly transmissible nightmare strain. People call it the Andromeda strain. You know, happily, as of this moment, it is still the work of science fiction, and we have not seen that. So that's the good news. So what's happening in the United States, right? All of these things, reported cases, test positivity, hospitalization, and deaths are all decreasing. And that's really great. You can see here what the trends are in the right side of this little table at the bottom across all these different metrics, the number per 100,000. So at this exact moment, we're in a really good place. And you know, so the summer camping forecast as of today is looking pretty sunny. Don't worry, I'm not going to keep my sunny disposition for long. Where in the US are the hot spots right now? You can see where the darker red and sort of brownish colors are, a little bit in California, Arizona, in the Dakotas, a little bit in Texas, but really not a whole lot of activity throughout the rest of the country. Oh, does someone have a question? Nope. Okay. So just an idea of where the activity is now. Jen and Brandon specifically asked me to talk a little bit about what's going on with variants. You know, I think everyone has probably been hearing on the news, it's not a surprise to anyone, that the most transmissible variant we've seen overwhelmingly to date is this XBB.1.5. People call it the Kraken virus. When people say that, it makes me sort of giggle because I had to Google what a Kraken was. Apparently, it's a Nordic three-headed sea monster or something. I don't know what that's about. There's nothing sea monstery about it, except it's more transmissible. I don't know if sea monsters are transmissible. I think people just like to be melodramatic. Anyway, XBB.1.5 has taken over as the predominant strain we're seeing. You know, the real data are through February 25th. The ones on the three bars on the right side of this little graph are modeled data out to last week. And you can see that they're anticipating it continuing. And, you know, what people have said to me is, okay, what's next? What's next? We haven't heard what the next thing is. You know, there's no little bit of something else popping in yet. You know, to replace what's the next thing after XBB.1.5, and you know, what does it mean for the summer camping season? That's sort of the $1 million question here. So before I get to the answer to that question, you know, we also are thinking about who's at risk in 2023, right? Just about everyone, whether they know it or not, has probably had COVID at this point, at least once, if not multiple times. Hopefully, a lot of people have also been vaccinated. And this graph, I think, is kind of cute because globally, it tells you where the different vaccines have been used. And then if you want to look in the United States, since we're a little focused on the US, this is, you know, these are the vaccines that we have in the US and where else they've been administered. So, you know, overwhelmingly, you know, we've had Pfizer and Moderna. We've early on had some J&J, and now we have Novavax. I'm not quite sure why AstraZeneca makes it onto this list. It's not approved in the US. There were US sites that did the studies though, so maybe that's why. But just to remind everybody, most people have had at least one vaccine and clinical disease. So whatever is going to happen now, it's on a background of a very different immunologic profile than we were talking about even a year ago. So I think that's the lens with which we're going to sort of look towards this camping season, is it's very different than last summer. At least that's my take on it. So global vaccination rates talked about, you can see sort of what the rates are. Canada and the US, we're some of the more well-vaccinated countries globally. These are the numbers for people who have actually completed the primary series, a little bit less dark blue in color, which, I think it reflects what we're all seeing is, even the people who got a single vaccine, a lot of times didn't complete their primary series. And then when you look at booster dosing, it's an even lower number. And if you sort of look in the United States, sort of by different demographic groups, by age, by sex, by urban versus suburban versus rural versus race, ethnicity versus health insurance, it's not surprising that fewer people in more marginalized communities have the full vaccine series and have been boosted. I don't think that's a surprise to anybody. So I am going to make a huge plug that the bivalent booster, which is the most recent Omicron booster that contains 2 different strains of RNA in its booster regimen. It's basically the ancestral strain. So the first strain, the same one that we were all vaccinated for with the original series, plus an Omicron strain spike protein. It specifically is the BA4, BA5 spike protein. It's not the more recent BQ and XBB spike protein, but it's close enough that it's still clearly having an effect on disease. And what this is showing basically, and this is from the CDC, is basically if you got this bivalent booster, the newest booster, and you compare that to people who never got any vaccination at all, the risk of dying is 8-fold lower if you got the bivalent booster. It's even larger discrepancy if you talk about people having severe outcomes or symptomatic disease. It's like 14-fold lower. And the risk of dying from a COVID-related complication for people who got this bivalent booster compared to even people who are fully vaccinated and boosted but didn't get this bivalent booster is almost double. Okay, so this is my argument that all of our staff and campers, if they're eligible, should be getting the bivalent booster before attending overnight camping programs. That's my argument. You can fight me on it, but you're not going to change my mind. I think we talked when we were talking about last summer about what the data are for effective COVID-19 on pediatric oncology. You all are seeing this way more than I do, and there's probably even more updated data. But the biggest effect is on delays in chemotherapy, and it's highly impactful, both for people who are symptomatic and asymptomatic with COVID, and the delays are not insubstantial. And I think we're all acutely aware of this. So doing everything we can to prevent our pediatric oncology patients and campers from getting COVID certainly is in everyone's best interest. So what's the summer forecast? So the latest thing that has me a little bit getting hives is, wait for it, XBB.1.16. I know, what? So the old one was XBB.1.5. Remember when we were going to call these Greek letters and not be all about numbers? Remember that? Yeah, I don't know what's happened. This is still an Omicron, but we're back to numbers. It's like, I don't know, distant cousin of Omicron. But anyway, so it was first detected in January of this year. There were only 2 cases in January in India. Then in February, there were 59. And now in March, there's already a lot more than that. So it's going not in a good direction. In India, the daily case rates have gone from super low numbers to more than 1,000 per day, probably because of this XBB.1.16. Good news, nobody's died to date. That's good, but that's just to date. But as you all well know, something that's in India is just a plane ride away from it happening here. So I guarantee you it's already here. It's already happening. What it's going to do to our case rates and how bad is it going to be? No idea. When is it going to peak? No idea, but it's coming. So buckle up. Honestly, based on everything we've heard so far, I'm more worried about bird flu than I am about XBB.1.16. I think you've all been hearing that, the reason eggs and chicken prices have gone through the roof so much is that there's avian flu, and they've had to cull large populations of chickens. And the big concern is this going to jump into humans? It's already jumped into humans, but is it going to jump in a way that then can be transmitted effectively human to human, right? That's where we get into trouble. And we don't know the answer to this yet, but don't worry. They're already stockpiling vaccinations that are specific against the specific bird flu strain. It's called H3N2. And of course, as you would expect, the wealthier countries around the world are already reserving all the doses, and the poorer countries in the world are not going to get to the table in this. And I don't know if this is going to be a thing, but it could be a thing. It could be a thing as early as this summer. So we're going to need to keep our fingers on the pulse of this. And if this does become a thing, we may be revisiting sort of our older COVID type approaches again, but I hope not. And I hope this doesn't become a thing. But honestly, I'm more worried about this than I am about XBB.1.16, but that's what's going to dominate the headlines, I think. So where did COVID come from? So I just want to take just a second to talk about this. This is sort of, the conspiracy theory, QAnon, tabloid fodder that, just occupies way too much of all our emotional energy. Is it a conspiracy lab leak from a lab in China, or is it jump from an animal? And yes, no. And is there an Energy Department report that says it really was a laboratory strain? And here's the bottom line. We're never going to know. And does it really matter? It's here, whatever. The latest thing is, it's sort of fascinating. This is a raccoon dog. I had never heard of a raccoon dog. It's sort of cute. So they have found raccoon dog DNA in some of the samples of the earliest cases of COVID-19 that have now gone and been retrospectively tested. Does that mean that was the reservoir? Does that mean it jumped from raccoon dogs? Does it even mean that the raccoon dogs were infected? No, it doesn't. But it means that the two things were in the same place at the same time. And this is getting a lot of press. So just wanted to sort of clarify what we know and what we don't know. And the bottom line is, no one is ever going to fully be able to say it didn't come from a laboratory leak. But honestly, all the evolutionary biologists that I have talked to really believe the overwhelming evidence is it did jump from some animal reservoir into humans, and it's not actually a lab leak. But no one's ever going to be able to prove that. So tell your QAnon friends. Anyway, so Camp Tecumseh, this was our mantra last year. And we did go through this, I think, on one of our previous town halls. So I'm just going to go through it super quickly for the people who either gave themselves a brain enema or weren't on those webinars. This was our last year's approach. As best as we could, we wanted to exclude undetected COVID-19 in staff and campers from our 1-week summer program, which happened toward the end of July last summer. We had a closed bubble during camp week, so no visitors. Once you came in, you didn't leave. Nobody else came in midweek. And we put into place best practices to limit its spread within the camp population if it was undetected upon arrival in our staff or campers. So how did we do that? Thinking that the COVID-19 incubation period was 2 to 10 days. Pre-camp, we required everybody to do a rapid antigen within 72 hours of arrival. We asked them to minimize travel and avoid large social gatherings. We asked them to mask in group settings within the week before camp, indoors or outdoors, and to alert camp leadership if there were any close contacts who tested positive within 10 days before coming to camp. And of course, if anybody felt unwell, not even to bother showing up. When everybody arrived, we did on-site point of care PCR testing on every single individual camper staff who showed up. Yes, it was high drama. Yes, it took a long time. Yes, it was really expensive. The reason we decided to do that was it's more sensitive than rapid antigen testing. And any positive test, we decided was going to disqualify anybody from coming onto camp property. So during camp week, we also had the staff daily self-antigen test. It was the honor system. I say sort of, because we had a colleague of mine in the hospital at work made this program that pushed out a text message to every staff member every morning, reminding them to document their COVID antigen test. It didn't work perfectly, but it was pretty good. Caused a lot of confusion the first couple of days at camp, but hey, camp's all about chaos, and so that was appropriately chaotic. And for campers, we had each member of our medical team took ownership of swabbing with antigen testing every camper once a day. And our plans, if we had any suspected cases in either staff or campers, was we had immediate quarantine plans. We had quarantine trailers. We did PCR testing, and anyone who would have tested positive would have gone home immediately. As I mentioned, we had a closed bubble, no visitors. Deliveries were remote handoff. Nobody could leave campgrounds except for sort of emergency appropriations who had to remain KN95 or better masked. And morning activities by isolated staff members were allowed. We kept pods. We had 6 mini camps. You could be unmasked around your own pod. For any cross-pod activity, you had to be masked. Sleeping arrangements were with pods, and all of our eating activities were also segregated by pods. You would think this is absolutely bananas. It actually worked really well. We had plans for what would happen if someone tested positive, and thresholds you can see at the bottom of what was going to trigger camp stopping early. But all that was pie in the sky. We had a lot of plans in place, but we had a couple of staff and campers who were excluded from participation pre-camp week because of exposures or symptoms. But upon arrival, we had 0 positive PCR tests among all our staff and campers. We had 3 individuals who we tested proactively for symptoms during camp week. They were all negative, and we had no positive antigen tests on daily testing. Now, some of you are thinking, oh my God, you did too much. See, it was all negative. And this is the funny thing about prevention and preventive medicine in general. When something doesn't happen, it means you won. It means you were successful. It doesn't mean you went too far and did too much. So you may be thinking that was too much and too far, but we at Tecumseh are calling this the biggest win, because we all were giving it about a 50-50 chance that we were going to be shutting camp down midweek, and it didn't happen. So we were super happy. This was how we contextualized it to our staff, because a lot of our staff were super skeptical about this and kept saying, is this necessary? Is this necessary? And this is what we said to them. And I think it really went home, and people took that in and they complied. We had very few cases of non-compliance with the policies during camp week. And when it was pointed out to people when they were being non-compliant, they took it very seriously. So what are we planning this summer? Again, it's very different. So the natural level of immunity in the community is higher, natural disease, more vaccination. And currently, subject to change without notice, there's very low levels of SARS-CoV-2 activity right now. Again, subject to change. So the current strains, we talked about this, although more transmissible, they're less virulent. Doesn't mean something worse can't happen, but it hasn't yet, so that's good. Our current plans is we are requiring all campers and staff to be fully vaccinated as per CDC guidance, and that includes the bivalent booster. Some of you are going to fight me on that, but I believe very strongly, based on the data that I quoted, that that's the right thing to do. With rare medical exception only, for medical staff approval for medical reasons only. We're going to ask people still to home antigen test within 72 hours of arrival. No symptomatic people allowed on campus. We're still going to PCR all campers and staff on arrival once, but we're not going to do any further testing after we admit people with a negative PCR. Masking is going to be optional, and we're not doing pods. I put asterisks after we're not doing pods, because actually we found out that there were some really good things that came out of doing pods. And Dennis and Dina can talk a little bit about what those were. But some people really liked some aspects of being in pods. So we're not going to do it for COVID reasons. We may end up doing it partially for other reasons that Dennis and Dina can talk about. But it was one of the most interesting things that came out of this COVID experience, was that there are some things that we may want to hold on to even as COVID restrictions sort of fade a little bit. I'll stop there. Happy to answer any questions. I would love to hear how other people are thinking about this summer, because obviously there's no right or wrong way, and they're all shades of gray. And there's all sorts of considerations to keep in mind that one size is never going to fit all. But thanks for your attention.
Dr. Rafi, one question that came up in the chat related to the bivalent booster on how it affects transmission rates. Does it lower transmission rates, or what can you say about that?
Yeah, we don't know the answer to that question, but you would believe that if it prevents severe disease, then it has some activity at lowering viral loads, and viral load is what we believe to be the best correlate of transmissibility. So I think it probably does. Do we have data for that? No.
Okay, thank you. And then there was a request if you could put the last slide up again.
Sure. Let me share again. This slide, what our current plan is that what people wanted?
Was that Deb from Camp I Hope? Is that the one that you wanted to see?
Yes, I was just taking notes and it went off too fast. Thank you.
Oh, I'm sorry.
That's
And
okay.
I'm happy to send these slides to anybody who's interested in having them to review or talk about with the rest of your staffs. There's nothing proprietary or secret here.
Dr. Rafi, another question came up about your thoughts on the day camp environment, because residential camp is so different.
Yeah,
Can you
no,
share?
it is different, and the risks are much greater, you know, when you're sleeping in cabins and having that much more prolonged and sustained contact. But at the same time, it's an extra layer of complexity, right? Because people are leaving the camp environment, going out into the world, and potentially being re-exposed on a daily basis. So honestly, that's not my area of of expertise, and I haven't spent a lot of time thinking about it. I can't imagine it would ever be feasible to repeat test everybody as they come in and out every day. I can't imagine that being a reasonable thing to do. And you could almost argue, if that's going to be happening, you know, absent symptoms, is it worth even testing people? Because they're going to go home and come back the next day. So I would love to hear, those of you who have non-residential camps, what you did last year and how you're thinking about it this year, because I don't know what the right answer is. Seems very Sisyphusian, right? I mean, you're pushing a rock up a hill continuously, because every time your campers leave the camp property and go out into the world and then come back, it's like you're starting all over again from scratch.
It is a major challenge for day camp, because you're right, they go home and you start all over again. We were lucky just to have a very small window of an issue of infection last summer, and we seem to be taking off our masks this summer. And our medical team, I'm Sunrise Day Camp and Mark Atlas is our medical director, still in consideration about exactly what we will look like.
Yeah, you know, these are really thorny questions, and I don't know the right answer. I don't think anybody is going to find mandating masks at this point acceptable, right? I mean, I think we're past that. You know, if you have a kid who's densely neutropenic or on therapy and you know, severely immune compromised otherwise, you know, it's certainly not unreasonable for them to stay masked, but
Yeah.
you know, having very little to do with COVID. But
So another question. Go ahead.
What is your gut with this new variant? Based on
yeah.
your experience, what I know you don't have the crystal ball, and I always talk about the crystal ball. What does your gut say?
My gut says that we're going to have a cross immunity with these more recent strains. So people who got XBB.1.5 or maybe even BQ likely will have some cross protection. I don't think it's going to prevent people from getting it, but I do think it's probably going to prevent it from being super severe. That's my gut. but honestly, we really don't have enough data yet.
Another question that came up is, how do you anticipate meal times to work? What are y'all doing at Camp Tecumseh? What do you plan to do?
So last year we were very careful with this potting, and only one pot at a time went up to the food lines, and people weren't allowed to serve themselves. And, you know, we were sort of super careful with sort of the idea that particularly the kids could touch something and then stick their fingers in their mouth and cross-contaminate. And we're going back to normal pre-COVID mealtime activities this year.
Another question that came up is with related to PCR testing. If there was any insurance cooperation last year that helped pay for that for you guys. Kristen from Camp Casco said that they did at-home PCRs last year, and insurance covered much of the cost, but they're hearing that insurance will likely stop covering the tests in June.
Yeah, so that's going to be a big problem, right? The national declaration of an emergency is ending on May 11th, and that's going to affect a lot of insurance coverage around vaccines and treatments and tests. So that's going to be a huge deal. We actually did not leverage any insurance to do that. We used the Abbott ID Now platform, you know, Tecumseh was able to leverage resources to pay for all of those tests for all staff and campers. So people just had to, the only thing staff and campers were responsible for doing their own was that antigen test within 72 hours of arrival. We did the PCR testing.
Another question had to do with outside visitors, day volunteers, etc. What are your plans for this summer?
All great questions. And, you know, last year we were incredibly restrictive. We said absolutely not. We had this incredible brigade of people who were on the outside volunteering to run errands and get things, and would come and drop things at a designated point at the camp entrance, and had no direct contact with our on-site staff, who would then sort of go get those things. So we're basically throwing all that out the window this summer, and we're the only thing that we're requiring is visitors who come onto camp property will be PCR tested on arrival. Delivery people, we're not going to require them to be tested, but we are going to mandate that they stay masked and not have direct contact with camp staff or campers during their delivery activities.
Beverly, your comment, I'm not sure if I know for what you were referring to. You said when looking at CDC guidelines, seems boosters are not considered in that definition. Do you want to clarify that point?
I'd have to go look at the actual language, but the intent is to be inclusive of that bivalent booster. And stay tuned. There's sort of terrorist chatter right now that there may actually be a recommendation for a repeat bivalent booster for certain populations, notably people over 65 and people with immune compromising conditions. I have not seen any discussion about whether that will apply to the pediatric and adolescent indications as well, but there are FDA and CDC discussions about that right now. So that's subject to change in the next couple of weeks, actually.
So related to that, there was a question about if it matters when the bivalent vaccination was received, like it was last October, is it waning? And that's probably part of the discussion they're talking about. They're trying to figure that out.
It is. I mean, right now there's no recommendation. So technically it's not authorized to go get a second dose of the bivalent booster. People do it. People do all sorts of things, right? But I don't think it would be reasonable to recommend or require it until there's an FDA sort of vote on that, and then CDC authorization. Otherwise, you're sort of flying solo on that. What we had said was whatever was required for our camp program be completed 2 weeks before the camp program.
Okay.
Brandon,
Yes.
I think that Beverly's question was related to the definitions, people use different terminology, and to be fully vaccinated, according to the CDC definition, still doesn't include the boosters. You have to be fully vaccinated and boosted. I think that's what she was talking about.
Yeah, so thanks. I'm gonna need to go. I haven't looked at the actual CDC documented language in a while. I think the intent is to include that bivalent booster. In fact, they've sort of gone so far now as to say, regardless of what you have or have not had before, you should go directly to the bivalent booster. So I'm not sure if the language is lagging, but I think that's the intent. I agree it'd be difficult to implement something that isn't said in the guidance, but don't worry, I'm sure it'll change 15 times and before summer programs start.
Thank you for that clarification, Dr. Mike and Dr. Raffi. And Beverly, did you have anything else to add to that comment or question?
Yeah, when I read the CDC guidelines, it definitely says that boosters are not included in the fully vaccinated definition, although it does qualify saying fully vaccinated, however, is not the same as having the best protection. People are best protected when they stay up to date with COVID-19 vaccination. So the thing is, so when you ask on a volunteer application, are you fully vaccinated against COVID-19 or chickenpox or whatever? So defining what fully vaccinated CDC is does not include boosters.
When we listed it last year, up to date was the term that they used for being the primary series plus a booster. And so that's what we talked about, being up to date, and in the parentheses put the definition of the primary series plus a booster.
Okay, and Susie, while you're talking, I was going to go to your question next. Would you like me to read it, or do you want to just ask it?
No, I can ask the question. So I'm curious, Dr. Raffi, on the whole issue of people who get exposed within that 10-day period before coming to camp, because I really struggle with this. Obviously last year everybody was vaccinated, but I still went by the CDC guidance of passing at least that day 6 and having a negative test and then masking through day 10. But I guess I don't know what the best recommendation is. If they've been exposed, you just have them stay home. If they've been exposed and you can cross the day 6 and get a negative test, can you bring them to camp with them masking through, that 6 to 10? Or because they're vaccinated, you say, go for it, come to camp?
I don't know what the right answer is. Our approach had been, if you were exposed within 10 days, you were out no matter what happened. Just because the average length of time to symptoms and disease is sort of within that 3 to 5 day window, but there are cases of later transmissions. So out of an abundance of caution, that was the approach last year. To be honest, we haven't talked about what we're going to do this year and if less restrictive policy is appropriate. I could see arguments being made either way, right? If your test negative 6 days out, right, then the likelihood is vanishingly low. And are you willing to accept that? I don't think that's crazy.
So we did of all the people that fell in that category last year, both campers and staff, we did not have anybody become positive. Nobody developed symptoms, and we were doing post-camp testing on their exit, and we didn't have anybody test positive. Again, it was small numbers, but that's
super reassuring though.
Worked out. So
yeah.
And we did have a few staff who actually said, you know what, I'll just rapid antigen test every day. And again, we did it both ways, but we were successful there. So
that's fantastic. Certainly reassuring.
Another question that came up related to day camp and residential. How do you think it would work having both day camp and residential camp happening at the same time, but on like different sides of the property? Would you do testing with both camps?
Oh, that's interesting. Is there any cross pollination between the camp populations? Like staff go back and forth at all, or campers?
Hi, I think that was my question. I'm from Michigan, Camp Petra Rainbow. I'm a new summer camp director. So yes, there is. However, we could separate it if need be in our dining hall, but that would be the only cross contamination that would be happening.
Yeah. 'Cause-
Activities wouldn't have any cross contamination.
Because if there's any sort of cross activity, then really the whole thing is like a day camp, right? Because you have a potential sort of new influx of risk every day within the day camp. And if it's cross-pollinating, then it affects everybody. So I think you'd have to, if there's any cross-pollination, I think you have to treat it as if it were a day camp, which
Okay.
isn't very helpful because I don't know how to handle day camps.
I appreciate the feedback though.
So one more question, Dr. Rafey. Has there been any research about how long natural immunity is lasting with recent variants for those who have tested positive?
Yeah, the problem is, so yes, and the thought is somewhere in the 3 to 4 month range. It starts to wane significantly thereafter. The problem, of course, is immunity has taken on a different meaning now than it did earlier on, right? We thought of immunity as prevention of infection, right? And it's pretty clear that as these variants continue to evolve, they're really good at escaping and still infecting. So the definition of immunity has really morphed into no severe disease, right? And so antibody levels start to wane significantly 3 to 4 months after natural disease. It's also fairly clear that the best immunity is the combination of vaccinated and natural immunity together. That's better than either one separately.
All right. One more question, and then we have a few other people who are prepped to just kind of give a thumbnail sketch of their plans. There was a question about if any camps are considering allowing campers who have not been vaccinated at all, which I don't know, that may be, I mean, it's not just for Dr. Rafey, it's more for, everybody out there. Anybody want to jump in and answer? I'll just say that in Texas, we are not allowed to ask about vaccination status because we have brilliant government here in Texas. But there are a number of things that we have not been able to do. Many camps who are not getting any kind of government funding from the state choose to go ahead and do it anyway and just, dare the state to sue them. We are in a different boat because we do get Medicaid waiver funding for many of our campers that would be at risk if we violated the state's order, the governor's orders. So we do not require vaccination. We can't even ask, or we can ask, but it's an optional question. They don't have to answer. And yeah, Jen is saying Montana is similar in that. Anybody else want to jump in on that? South Carolina.
Brandon, Dr. Rafey and I already had some communication about this. So Camp One Step, we were very strict last year, or the last couple of years. We required vaccination for all staff and campers, with the exception of a few medical exemptions. We have gone back and forth quite a bit this year, and looked at both the data that came out of the COCA survey. We did our own survey amongst our camper families and asking their interests. We looked at Illinois and Wisconsin and the recommendations for school. So we have gone to strongly recommended but not required this year. Crossing my fingers, we'll see how that goes. I think those of you who know me know that I'm very strong on vaccination. So it will be an interesting year and we'll follow it closely.
Thanks, Susie. We did have a few people that Jen had reached out to earlier to see if they would be willing to kind of give a thumbnail sketch of their plans for the summer. And so that is Travis and Alex and Lindsay. I don't know if y'all can jump in. We have about 10 minutes left. You can also post some things in the chat if you want, but I want to give y'all a chance to just weigh in. So Travis.
Hello, Poncho here from Camp Horizon, Tennessee. I am an emergency physician and I am very pro-vaccination, so I'll just put that out there too. The reason why I want to say that is because we are probably going to drop back our requirements. Last year we were very strongly bubbled, and this year, and we had no disease as far as anybody knows, any follow-ups. This year we will likely be doing the pre-testing before arrival, and last year we did require a PCR testing of some sort. Antigen was not going to be acceptable for the pre-testing, and then we did antigen testing on arrival. This year we are hoping to do PCR testing on arrival. We'll see how that works out based on testing process and such. The idea through the week, we won't be doing testing during the week. There's going to be a lot of honor system on symptoms. We'll of course have our normal check-ins with our staff, and our counselors were really fantastic last year on basically having a morning check-in with every single camper and then reporting to the med staff any kind of issues. We right now will likely have no requirement, however, strong recommendation for vaccination for all campers and staff at the moment. That's really kind of our fuzzy zone, and a lot of that has to do with even just being able to hold camp. So the idea is that the zone of strongly recommended for staff or required for staff is really kind of the zone where we're at right now in the decision-making process. If we decide to go no vaccination required, but strongly recommended no matter what, we will likely have the caveat that we might need to, depending on scenario of region and country and such, we might hold kind of a fine print section where we might have to rescind those who are not vaccinated coming to camp. We will be having some level of cohorting. Probably last year we were very, very tight cohorts. Again, I think it was well received by many people for various reasons. We might have larger cohorts perhaps this year, masking voluntary. I think that was, trying to think of the different points. Yep, I think that's it.
Awesome. All
For
right,
the
Alex.
So one of the big things that kind of what was mentioned with the COCA-I is like we really put a lot of emphasis also on the pre part of camp, so asking people to limit their exposures before they come to camp. We are requiring at this time the bivalent booster for all participants. Part of that decision is our volunteer medical base, and these are their words, not mine. It is an older group of volunteers, again, their words, not mine, and they want to make sure that they are keeping themselves safe as well as when they're going back to the hospital. So at this time for our events, especially coming forward with our first family camp next week, everyone will be required to have the bivalent booster. We are in California, Northern California, allowing us to have a little bit more flexibility with people cooperating with that, but we still have had some pushback in regards to it. So because we're still waiting to see if the CDC officially puts the bivalent booster, the language with that. So if it's recommended, we're just requiring it. So that is kind of to keep both our medical base and our campers safe. So again, a lot of that pre stuff of making sure that our volunteers and our staff are taking care of themselves before coming into camp. What we did last year that worked really well is any upper respiratory infection type symptoms. It was, hey, you just got to reschedule for next time. Like, we don't want to know. I believe Dr. Jolly is on this call, says you test, and you better trust the history more than the examination. So because they have those symptoms, we want to make sure that we are kind of keeping that in mind as we're going forward. We will be doing testing upon arrival. We did antigen testing last year and we're looking to repeat that this year. So before anyone's allowed on property, we do antigen tests to give them their negative result and then they're clear to go in. Right now, we're still talking about doing masking in shared spaces just because that is some of our families' concerns or wants are looking for us to kind of have some of that. So allowing them to have that safety of mind for those who are choosing to be bivalent boosted and coming to camp. We want to make sure that we're still helping them feel comfortable coming to camp, because that was one of the big things that we saw from last year was a lot of the families who were going the hoops that we were asking for our families to participate in, they really appreciated it, and we are going to get bad feedback from those who weren't happy with it anyway. So focusing on making those who are happy happier than trying to appease the ones who are already going to be mad at us for no reason. And again, anytime there's symptoms, we have tons of the antigen tests through a department of California Public Health. They provide them because camps fall under the school umbrella. We are still provided them to use. So we're using that. And I think that's really kind of the big ones, is just kind of waiting to see what other people also say as we kind of really fine tune some of the smaller details, just because as we're seeing, information is changing. The CDC may or may not be removing restrictions or changing verbiage. So just kind of taking it as we go, but just still, I think the big one that we're firm on is that bivalent booster, because as Dr. Rafey said, it does help a lot. And we think that is the best for our campers and our families and our volunteers.
Awesome. Thank you, Alex. And Lindsay, you want to jump in with your update? Lindsay,
Well, I'm not Lindsay, I'm Gail, but and I'm non-medical, so this is kind of like the blind leading the blind. But nonetheless, we have not held a camp in since before COVID, so this is all new to us. We're really just listening and learning for a large portion of it. Some of our takeaways is we had anticipated to do much more strenuous. We're located in the middle of nowhere, Saskatchewan, which is a province in Canada. So our rules are a little bit not as strict as some of the US rules can be. So we're really just trying to figure it out. Our biggest concern was somewhat of the meal times and that kind of stuff. It's kind of a dichotomy. On the one part, you want to keep everybody safe, and on the flip side of it, there's also all of the activities and the bonding and the cabin fun often happens at mealtime. So we were worried that we might have to be moving it outside, but from the sounds of it, you're going to be following many of what I would call the educational system that we have in place now. So it's kind of back to normal, if that's what a lot of it is. So I wish I had more to contribute to what we should or shouldn't be doing, but really it's more of looking to all of you and thanking you for some of your expertise, advice, and as we can learn along the way. So I'm not sure where we lost our nurse, but that's an update from Saskatchewan.
Awesome. Thank you. Thank you. We are hitting the end of the hour. And I know I can stay on for a few minutes if people want to stay over. And there are other questions I'm not sure about Dr. Rafey and anybody else. I don't want to commit anyone to that. But are there any last thoughts, Dr. Rafey, that you would like to close with?
I don't think so. I just really appreciate everybody's willingness to, share what their experiences are. There's no right answer to these things, and it would be nice if there were. Everything is shades of gray, and what you are able and sort of think is the right approach for your particular camp. And I think we all have the same goals in mind, which is keeping everybody safe. So just appreciate everybody's collaborative approach to this.
Awesome. Well, it certainly has been a learning curve for all of us over the last 3 years. And I, for one, am grateful for COCA and the response that it as an organization has made. And so cheers to our staff, to Jen. Callie is new on staff, but we do have some excellent staff at COCA who really keep moving these things forward, and just wanted to give a shout out to them.
Thank you.
Yeah, absolutely. Any last questions or announcements, Jen or Callie?
No, thank you all for being here. I wish you the very best with all your plans this summer. We love y'all.
Book your rooms for COCA-I.
There you go.